Okay, Johnny, so we have just recently done your plaque index score, and I'm going to hand you this mirror so you can look at all the purple and pink areas in your mouth. So what this is showing is it's a disease-detecting liquid, and biofilm accumulates to your teeth, and if not removed mechanically, it can cause the breakdown and demineralization of your tooth surface, which causes caries, which in your terms is cavities. So we did some probing depths, and you heard me call out 1, 2, 3, some 5s, and some 6s. I'll show you here on your chart. So anything from 1 to 3 millimeters is healthy gum tissue. At 4 millimeters, it's a red flag, some concern for us. A 4 is usually gingivitis, but anything above a 4 means periodontal disease. And periodontal disease is irreversible. That is bone loss. So with some of your pocket depths, you do have some 5s and 6s, so that can mean that is bone loss. That's periodontal disease. And that means the biofilm accumulated and got down and started demineralizing the tooth structure and down into the root structure as well. And so we need to work on some better home care for us to maintain those numbers so they don't get any worse. With the 4 millimeter pocket areas, if we stimulate the gum tissue and get the biofilm out and clean those teeth better, we can reduce those numbers so next time you come in, we can see some more 1 to 3 millimeter pockets. With your x-rays, you can see those areas that have the 5 millimeter pockets, and you have the active decay, like right here. You have some active decay, and then you've previously had a root canal treated too. So you know the process of having, click on something. So you know the process of having a cavity. If it's not taken care of, you can end up having a root canal, and we don't want that to happen. So I'm going to show you kind of a breakdown, but with a graph, everything that I just talked about, but visually. Here's biofilm, and you personally don't have any health risk or anything right now, but you do have a history of diabetes and high blood pressure and alcohol abuse in your family. So that is the oral systemic link. So if you don't have any of those conditions right now, we want to work on keeping that, and everything starts with your mouth. So keeping our mouth clean keeps our body healthy. So in areas you have 4 millimeter pockets, it leads to gingivitis, and then if those aren't taken care of, it leads to periodontal disease. And you drink lemonade frequently and energy drinks. So that will, with the carious lesions that you have, that can make your cavities progress at a faster rate if not removed. After 20 minutes, the acid from those drinks sits on your teeth and breaks them even faster. So here's what the plaque effects with the biofilm that we did. This is in my little chairside instructor. So this is kind of what your mouth looks like. You had 90% of biofilm in your mouth. So we'll talk about brushing in a second once you show me. And then with probing depths, let's see, it's right here. So this is what I was talking about with the 1 to 3 millimeter pockets. We use our little tool. The 2 millimeters you can see is healthy, but with you and the 5s and 6s, we're going down way deeper. And you can tell this is more visual, more extreme with the bone level loss. All right, Johnny, I want you to take your toothbrush, and I want you to show me how you brush at home. I know you said that you don't really know what your toothbrush looks like or even use it or anything like that, but if you were to pick up your toothbrush and use your toothbrush, go ahead and use it at this time he would show me. Then I would make modifications. So I'm going to recommend the modified bass for him since he has period disease. So Johnny, I'm going to take the toothbrush, and I want to do small circular motions and swoop down. Small circular motions, swoop down. And do that and stimulate your gums because of that bleeding that you had. You had 75% bleeding. So helping stimulate your gums will really get that blood moving and helping in those areas. So with your anterior teeth, I want you to go back and forth put the handle towards the floor on the top. Sorry, and go about 3 to 5 times, up and down, and move to the next tooth. And the same on the bottom, up and down, you're gonna put the handle up towards your nose, up and down 3 to 5 times, and then move to the next tooth. So we really wanna work on that at home. Then also with flossing, you said you don't floss, so we want to take our floss and do a C motion. So you're gonna go down, and you're gonna cup the floss to a C, you can see, and go up and down 3 to 5 times, and then go to the other side of the tooth, up and down 3 to 5 times. I'm going to do that all over. I also would recommend that you stop using the phenol mouth rinse several times a day because it can create the white spots on your teeth. I would recommend using a fluoride toothpaste and a fluoride mouth rinse because of the carious lesions that you actively have, and it will help prevent further carious lesions. And and then I would also get him, if he's not around floss, I would ask him if he can use a toothpick stimulator and show him how to use that, but I don't have that at this time. When he's on the go, just so he can stimulate his gums, I would then get Johnny to show me what he learned and ask him if he has any questions, and make sure to stress the limiting the phenol mouth rinse and also the energy drinks and lemonade. Get him to limit that. And if he does want to do that, then make sure that you brush immediately after. And that is it.